The world commemorates World AIDS Day on December 1st. Inequality, stigma, and discrimination have been identified as major challenges in the fight to eliminate HIV and AIDS, not only in the Gambia, but the world at large. Now, the office tasked with coordinating the fight against the spread of HIV and AIDS in the Gambia is the National AIDS Secretariat, and early Wednesday morning held a press conference to speak on the challenges faced in the fight to eliminate the disease. Maria Macham tells us more of that in this report.
Inequality, stigma, and discrimination are said to be factors that are hindering the fight against HIV and AIDS globally. These factors were identified by the National AIDS Secretariat as it gears towards the commemoration of the World AIDS Day on 1st December. The commemorations began in 1988 and are usually dedicated to raising awareness of the HIV and AIDS pandemic and also to remember those that died of the disease. The theme for this year's commemoration is putting ourselves to the test, achieving equality to end HIV. The theme encourages people to unite globally to eliminate the disparities and inequalities that create barriers to HIV testing, prevention, and access of HIV care. The director of the National AIDS Secretariat, Usman Baji, called for collaboration among stakeholders to address the inequalities.
What we need to do to address the inequalities, all partners around the globe, including the UNAIDS, WHO, and other partners, have agreed that we must intensify efforts to increase availability, quality, and suitability of services for HIV treatment, testing, and prevention, so that everyone can be served. So as we speak now, when you talk about HIV treatment, there are still communities that are underprivileged or underserved. So in our national response to HIV and AIDS, and as a country, we are working with partners, including the UN and the civil society organizations, to make sure that treatment services are expanded to the closest point possible so that each and every Gambian is well served.
Sirif Baji, Assistant Program Manager at the National Control Program, said the fight against HIV will not end soon if eventually new infections continue to be registered. Mr. Baji estimated that over 25,000 people in the Gambia are living with the virus and that actions is being taken to address the situation.
According to the UN estimate of 2022, 26,000 to be precise, 26,229 people were living with HIV in the Gambia as at December 2021. Out of that number, 14,000, that is 55%, 14,348 people know the HIV status. 60%, that is 8,695, we are receiving treatment. The country therefore needs to redouble its effort in improving access to testing, treatment, and address the stigma and discrimination. The country, for your information, has recently established 9 sites. These are centers where people can walk in and get your treatment, and 24 PMTCT sites. These are sites where services are provided to prevent mothers who are positive for their unborn children. Centers, in addition to the existing, currently you have 14 sites and 57 PMTCT sites and 69 HIV counseling and testing sites. These are centers where or facilities that you can walk to if you want to know your HIV status.
Mrs. Sira Horajandau, UNAID Country Director, said that the current data should be a reminder of the challenges created by inequalities, which is holding back the fight to end AIDS.
According to the UNAIDS Executive Director, and I quote here, "An inequality that breaks my heart is that against children living with HIV. With the science that we have today, no baby should be born with HIV, and no child who has HIV should be without treatment. But today, while 3/4 of adults living with HIV are on treatment, only less than half of children are. This is intolerable." End of quote.
The HIV and AIDS epidemic not only affects the health of individuals, it also impacts households, communities, and retards development and economic growth of nations. Many of the countries hardest hit by HIV and AIDS also suffer from other infectious diseases, food insecurity, and other serious problems. Reporting for Eyeafrica News, I am Mariama Cham.